Hello, this is Forget Behavior, Understanding Autistic Cognition, and I am Osvin Latimer. A little bit about myself before we begin. Oops, sorry. Um, I am an autistic consultant. I primarily work with BCBAs and other service providers to understand what autism is to then help shape their practices in a more neurodiversity oriented way. I'm also the founder and president of Foundations for Divergent Minds. We do disability justice specific for autistic and other neurodivergent people who with a specific approach and framework that we build all of our programming by. Right now, we have programming with in education, but we are expanding into providing other means of other projects or programs with healthcare and hoping to expand into police interactions and domestic violence realms so that we can truly look for equity across many different facets of the lifespan. I have been a activist for over 10 years. Previous to FDM and my own personal work, I also worked for the Autistic Self-Advocacy Network as the Director of Community Engagement, where I did some policy work in education, Health and Human Services, Department of Labor, and so forth. So have many years of experience with that, as well as being an autistic parent to autistic kids. I have a 17-year-old and a 16-year-old who are autistic, and then a 7-year-old who is neurodivergent. And so when I speak of things, it is informed by all of these things coming together. And I use a lot of research to support what I'm also saying, as well as what the community has said. In this discussion today, you will come away with understanding the being able to explain the benefits of understanding autistic cognition, breaking down the effects of executive functioning on behavior, and identifying multiple methods to support unique sensory systems in autistic people. So let's begin with what is autism. And I'm going to start with the diagnostic criteria because I really want to help y'all reframe the way that we think about autism. But the first part is to understand what people see things as. So we know DSM criteria says that it's a persistent deficits in social communication and social interaction. And we will go through and explain this in a moment. And this can appear in emotional reciprocity, from abnormal social approach to failure of normal back and forth conversation, reduced sharing of interest, emotions, or affect, and to a failure to initiate or respond to social interactions. So basically, we're really bad at starting conversations, keeping conversations going. We don't share our interests and all these things. And now if we take a moment for that, I think that it's kind of interesting when we get into the severity into like point 3 of that, where we talk about the fact that we have restricted and fixated interests. The only way that we know that information is if somebody's talking about it a lot. So I think that we need to recognize that some of this starts to help us see that maybe some of the ways that we are reacting to things happens to be a interaction between the way that we are responded to and the way that we think. And again, we'll get into this a little bit further down the line. Then we have deficits in nonverbal communication used for social interaction, from poorly integrated verbal and nonverbal communication, abnormalities in eye contact and body language, or deficits in understanding and use of gestures, a total lack of facial expression and nonverbal communication. And then third would be the deficits in developing and maintaining and understanding relationships, ranging from difficulties in adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or making friends, to the absence of interest in peers. And so many of those sound really, really terrible when I read them. And because I don't see and frame autism in this way at all. In our secondary category of restrictive and imperative behaviors, then we start to see things, stereotype and repetitive motor movements, use of objects or speech. So this is echolalia, and this is stimming. That's what this one is talking about. The insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal and nonverbal behavior. Then we have highly restricted and fixated interests that are abnormal in intensity or focus, which we would never ever say to somebody with a PhD. And then hyper or hypo-reactive sensory input or unusual interest in sensory aspects of the environment. So basically, we're looking at a lot of ways that people interpret the way that they see an autistic person. This means that there is a lot of social bias in in our diagnostic criteria. This means that we have a lot of concerns that are an end product of what's going on with an autistic person. And the end product isn't really the important part. The end product is how we interact with the world, yes. But from that, we end up seeing a lot of problems with the ways that we then start to think of what we need to do for treatment. If all we're trying to do is change these last things, and these end product things, then we are doing a major disservice to autistic people in ways that has lifelong consequences. And we can see this in the way that we, in most of our developmental psychology that we know, that this focus on what a child is doing wrong then sets them up to have lower self-esteem and have lower mental health outcomes. We end up seeing a lot more depression and anxiety because of it. And that's really, really upsetting when we can instead look at things from a completely different lens. So I want to start out with our sensory processing. It is the one area that is actually inside the DSM criteria that I happen to agree with because we have a lot of science behind it. We know that autistic people process sensory information differently. We can be hyper-reactive or we can be hypo-reactive, but I have yet to see an autistic person that is middle of the ground on any sensory area, especially when we have heightened states of emotion. So what are our sensory processing areas? First, we have visual processing. So being this is seeing our environment, and this gets into, and if we think about it from a sensory we think about sensory information, then we need to recognize that all this information that comes in, if we are hypersensitive to visual information, then a cluttered environment might be overwhelming. If we're understimulated by visual information, we may need more contrast, more colors, more things to be able to recognize the things in our environment. I will stop there on that one instead of going into the next part because we get into the mixture in just a moment. We have auditory processing disorder. This is our ability to take in auditory information. We tend to also be hyposensitive to this. If we're hypersensitive, then there's good research out there that shows that it can be physically or it can be distressing. We can see the same areas of the brain light up as if we were experiencing pain, which then says that we are experiencing pain. I think that's really important to know. But if we're hypersensitive, then we tend to not attune to the sensory input in our environment. I frequently use during presentations the fact that my computer has a fan on it. I can't stop hearing the fan no matter what I do. Even with these earbuds in, even if I had headphones on, I would still be able to hear that thing. There's also in my office, just down a little bit, is the elevator, and it dings all day long. And I hear it, even though my office moved down the hall and I no longer and right by it, it's still further down, but I hear it every time it goes off. And so we need to think about these things in the ways that we are setting up our environment, so that we know that we need to do more to reduce the stimuli that a person's brain is having to interpret. This gets into cognitive load theory. Like if we can recognize that that our brains are still processing this information, it's not habituating it, is what the term is in that particular research. Then that means that is taking up part of our working memory system, which we will get into in a second. Vestibular is our need for movement. So we are here. We need movement. Balance, because the vestibule is in the ear. Sorry. That I have personally a really terrible vestibular system. I don't feel my body in space because of the way that I process information. However, if I am turned upside down or spun really rapidly, then I can get really sick because suddenly I am feeling my body. Next would be olfactory. So this is our nose, our smelling, and this also can be hyposensitive depending on the person. This has implications for people that wear scented products. You might see within autistic conferences, once we go back to in-person, that there are several that will say that you need to not wear heavily scented items. This is the reason for that, because it can be overstimulating for some people. We have tactile. So anytime that we have touch, we may, light touch especially may be hurtful to people, but you may also seek out a lot of touch. Proprioceptive system is this is our movement. So we need a lot of, or some people need a lot of movement, some people need less movement. And the movement that we get may need to look a certain way. It may need to have a lot of heavy work aspects, this sort of thing. Next up, we have interoception. This is our ability to tell what's going on inside our bodies. And there is a heavy correlation between this and alexithymia, the ability to interpret your emotions. And so this can mean that we may not feel hungry. We may not know when we need to use the bathroom. We may not know when we're in pain. And that doesn't mean that you're not experiencing pain. It just means that your brain isn't interpreting the signals and telling you what it is that you're feeling. And then finally is our gustatory. So that would be our taste buds. And so we can be hyposensitive to that. This gets us into like same food categories and this sort of thing that you may see if you look up actually autistic hashtags. Next, we have our executive functioning. And this is where we get most of our diagnostic criteria from. So I'm going to go back to the diagnostic criteria so that we can talk about this. So I'm just going to go down and I'm going to pick out things here. Hold on, let me read this question. I will answer that after the fact because I feel like it will derail the conversation, but I will answer it at the end of the session. So deficit 1, social emotional reciprocity. From abnormal speech social approach. So this would be our initiation. Actually, no, we get there. We get there at the end of the section. So failure of normal back and forth conversation. So let's talk about this. Let's talk about what this is. This is actually, that one is a terrible one. Let's go ahead because I have to go to the next slide, and the next slide will be perfect for that one. So the failure to initiate is literally our initiation executive functioning, which we know autistic people have a harder time with that particular skill. Actually, the skills that we know that autistic people are have the most difficulty with are initiation, are shift, are self-monitoring, and then planning, because this has to do with prioritizing. We actually have higher than normal working memory if we do not have a co-occurring ADHD disability. And if you have ADHD, then you probably don't have great working memory though. And there's nothing particular about, or this is where we also get our difficulties with activities of daily living from. Because if we can't shift from what we're doing to something else, if we can't initiate the next task, all these things can then make our ability to do our activities of daily living more and more difficult. We also can get in here with this highly restricted and fixated interests that are abnormal in intensity or focus. Then we are looking at the shift component as well as the working memory component. And this is a very lovely way of how our brains, while we can say they don't shift well, we could also say that they focus exceptionally well. So recognizing that each one of these, if we say that we're bad at doing this thing, at the shifting thing specifically, then the opposite end of that is that we're able to focus really quickly. I'm also going to point out here with inhibition, you can be so inhibited that you don't move forward, or you might have really good impulse control. And those are both the same thing. That's the same exact skill, but the way that it presents in our world can be very, very different. So let's go into the complexities of autistic thinking. And this is where I can now dive a little bit more into this criteria. So when we talk about abnormal social approach, well, we need to look at why that might be. Because if we know what is going on with a person's cognition and how that mismatches from reality and from social influence and all these things, then we can start to create accommodations to help support a person better. So abnormal social approach. Well, what information are we getting in first? We know what information we're getting in. We're getting in this visual information. We're getting in this auditory information. We are also probably getting in either some of the interoception, or we may any of these other or tactile cues. So if we don't like hugging, if we don't like shaking hands, if we don't like physical contact, then that will look like an abnormal social approach because we are avoiding that sensory information. But it is not necessarily that we don't want to be social. And we actually have plenty of research, or getting more and more research now, that supports that autistic people do want to be social, but there are things that inhibit our ability to do so. And it starts out with the information we're getting in. But then once we have that information in, we may also start to struggle with that initiation piece. We can do that even if there isn't a socially mediated reason that we are having trouble initiating. But if we also have a social mediated, so when I talk about social mediated, let's talk about a third grader. And for a long time, they initiated this social interaction. They would get up there, the ability and motivation and everything to go over and initiate an interaction with their peer. And then because they did it wrong, and I'm using wrong very, very generally here, that child that they have initiated with, that neurotypical child, may reject them. And oftentimes will reject them. And we have a piece of research called Thin Slice Judgment. I love this piece of research that shows that non-autistic or neurotypical people are more likely to want to not be an autistic person's friend by just looking at them. What's very interesting with that is that if you look at writing samples of those same people, then they do not reject them and actually rate them whether or not they want to be their friend either way. And so we're getting into this recognition that that can then create trauma with that autistic child if they've been rejected by many people over and over again. Then they may struggle even more to initiate because they are fearing that rejection. And so it then compounds the issue that we are having. Now, let's go on reduce sharing of interest, emotions, or affect. So this gets into our issue or our next set of issues. So like if we are talking about this interoception and we're not able to recognize the way that we feel because we don't know or we're not getting our body signals in. We're also usually not getting social emotional learning into a child's home or school in any way that's useful to the autistic child. It gets really, really sketchy because an autistic person does not have the same body language that a neurotypical person does. We don't. This also gets into like the next thing, but I will get there in just a moment. So we have not had a whole lot of chances to learn what our emotions are, even if we are able to read them in the moment, which we're normally not. We can be reflective on the way that we felt. We can guess how we will feel if this thing is about to occur, but we can't always tell how we're feeling in the moment without like a direct ask and then the ability to stop and reflect on what our body signals are telling us if we can understand them. So this reduced sharing of emotions and affect has very little to do with that and has a lot more to do with what our body signals are able to give and then being able to communicate that. And then failure to initiate or respond to social interactions. And again, this is the initiation piece. And then we might also be having a delay if we are getting a lot of visual and auditory information in at the same time. We may not be able to recognize what is the important information, which gets into our prioritizing and our planning and organization and self-monitoring. All these pieces end up just kind of melding together in a way that shows that these end products are a complex set of things that are happening within the autistic person's brain. It is the way that we interpret sensory information that we're getting in. It is the way that we then synthesize that information in order to get a task done. And then the way we output it. So all of these things together then help us to see that maybe some of our some of the things that we should be doing is not so much focusing on what the end product behavior is, and instead accommodating these areas. We can do the same things that we were just talking about there with the next set of social communication and interaction differences. So non-communicative or non-verbal communicative behaviors used for social interaction, from poorly integrated verbal and non-verbal communication. And this goes into what we know from the double empathy problem. And if you are taking notes, please write down the double empathy problem. The double empathy problem says that that conflict within two people in an interaction, if one is autistic and one is neurotypical, is not solely the basis of the autistic person. It is that we learn and interact differently based off of our experiences. And again, we're talking about all of this really, really complex social thinking or autistic thinking here. Sorry, not social thinking. We know that that's not what I'm talking about, right? I need to make that clear because no social thinking. But autistic thinking, if we think about the way that autistic children learn, non-autistic children learn specifically, or sorry, neurotypical children specifically learn, it is that you start to recognize yourself in the people that are around you and can start to make judgments based off of how you feel when you're doing the same kind of reaction. Well, what if everyone around you is using completely different body language than you? Imagine you look at somebody that is looking away from you when you're talking to them. For a neurotypical person, or if you've been taught very much in your life social skills, then you know that a person looking away from you is maybe disinterested. But as an autistic person, that's not why I'm going to look away from you. I'm going to look away from you because I am wanting to hear what you say. I am going to not want to become really distracted by the visual information that you are giving off. I may also get really confused by your facial expressions because they are not the same facial expressions I would be using. And so that makes it really confusing to be able to engage that way. So we can't make the assumption, or so when we make the assumption that we're all going to have the same body language, even though we are getting completely different sensory information in. Yes, the environment is the same, but the way that you attune your sensory information is completely different than the way I'm going to attune mine. Then I'm not going to be able to guess what your emotions are, and you're not going to be able to guess what mine are. You're going to have to learn that by rote, like we have to learn yours by rote. This is especially important if you are a neurotypical parent of an autistic child, if you are a neurotypical teacher of an autistic child, if you cannot read their emotions. And it's completely inaccurate to say that we do not have facial expressions. We have different ones, and you have to look for different cues based off the way that we show sensory, sensory information and the body regulation that we get to be able to show our emotions through this complex set of, sensory information and executive functioning skills. This then gets into this deficit of in developing, maintaining, and understanding relationships, from difficulties adjusting behavior to suit various social contexts. That would be because we don't know what the rules are, because the rules are different from our rules. And I think it's really important to get into autistic culture and understanding what we do for social context in order to have shared understanding between everyone in the group, because we can then adapt those things into the ways that we help an autistic child learn to navigate social environments while not expecting them to change their autistic presentation. And then difficulties in sharing imaginative play or in making friends. And this goes back again into the double empathy problem. It's not just that we're having a hard time making friends, it's that they don't want to be friends with us. And we need to recognize this as a thing. The last part of this one, to the absence of interest in peers. Imagine you've been rejected from the time that you're 18 months old, 2 years old, until you are in kindergarten. Every time that you go out and do something, because you either don't know how to speak, or you look different, or you're flapping, and children are kind of mean, and they are going to try and not interact with you. At some point, that rejection gets to be enough that you don't want to be friends with people. You don't have an interest in your peers because everything has hurt emotionally because you have been rejected that much. We can go into the stereotype repetitive motor movements using objects or speech. So our stimming. This is going to be regulating our emotions. This is going to be regulating our sensory information that we have already here. We have this understanding of what our, sorry, let me go ahead and go back here. If we know that all these things are hyposensitive, if we already know that we're getting either too much of that information in and can't attune it, or that we're attuning it really, really fast, like far faster than our neurotypical peers, then we know that we're going to have to do something to get that sensory information in so that we are able to move our bodies, so that we're able to feel our bodies, so that we are able to stay sitting upright. Do you know how hard that is? If you don't feel your body in space, like I don't feel my body in space right now, I'm still sitting upright. I still have to think about that. I have to think about all this effort that I'm putting into my body. And so this is why I have a high back chair. The problem is that it gets me a little bit too far away from the microphone. And so I don't do it for speaking. But like any other part of the day, I'm going to be leaning back in my chair so I can feel at least where my body is in this chair. So we're talking about this whole area where we are sadly expecting somebody to stop the motor movements that are just getting our body in tune with the information we're getting in, which seems really, really wrong if we're going to start trying to say you shouldn't do that. Well, what are you doing to make sure that those needs are met? And I would also say, and I know that some autistic people may not be happy with this, but if you're seeing a child stim that often, then you need to be doing a lot more sensory-wise in your environment so that they don't have to stim that much. This is not about reducing stims. This is about making them comfortable in their body. You want them to be comfortable in their body. You want them to be comfortable in their environment. Let's see, insistence on sameness, inflexible adherence to routines. Okay, this gets into another deep dive. Now, we need to know a couple of things going on in this before we get started. We have to know that 80%, or the newest research shows that 80% of autistic children have the characteristics of developmental coordination disorder, or otherwise known as dyspraxia. Okay, we need to know this first and foremost with this, because it then gets into what we need to do motor planning wise to be able to go to do each thing in our day. If you change any one of those things in a routine, then you have to remake all of your motor plans. Literally all of them, because you have just set up a circumstance where you're not getting, where the pathways that you have learned to move your body have just irrevocably changed. And that's really hard to do in the moment. If your body doesn't naturally do the motor planning, then, sorry, then we're going to have to, then adjusting that is going to mess up everything else for the rest of the day, because your body isn't, because you're expected to make that change and you're not given enough time to. But this also gets into our problems with shifting. If we have a lot of routines, then we may be having a hard time shifting because, one, we might not know what's coming. So this is a really common accommodation that you can see in IEPs, especially is that you will alert a student to any changes that are coming that are unexpected or different. This is where that comes from. You're still, a lot of the things that we do already. I will come back to that after I finish this up. If we can know what's coming ahead of time, then we can adjust what our expectations are. And since none of the expectations that we know are of our own creation, they are external expectations. And since we can't predict what other people are thinking and feeling because we do not read their body language the same way that they read each other's body language, we can't make all these decisions, or we can't make a clear, or we don't have a clear understanding going forward, like what our what is needed. And so since we can't predict that, that shift that can happen unexpectedly can be really, really hard. So having preemptive warnings, letting somebody know that they need it, that there's a change in plan well in advance. Well in advance is going to be different from person to person. Some people well in advance may be the morning of. Other people, it may be a week's notice. We need to know all of this information so that we can help a person be able to shift that mental, and then having wait time after that shift, even if it's a known shift ahead of time, we want to be able to shift it after, or we want to be able to give a little bit of recoup time after the shift has happened so that somebody can regain their emotional regulation, because this can be disruptive to emotional regulation. All right. The question was, how do you know if you feel your body in space? That's a really good question that I do not have an answer to. I am going to make an assumption that people that do feel their body in space don't have to work nearly as hard to sit up. I suspect that it also has a lot to do with like this core muscles. Like I know that back here, I can feel through my body because there's something touching my back. But if I'm like this, all I feel is gravity against me. I feel gravity pulling me down, but I don't actually feel my body. So if you are an autistic person and are able to access occupational therapy, I would recommend that at least for the evaluation to see like what your sensory things are, if you have access to that. I know that the Autistic OT is also offering to do interviews and a profile screening to see as well. Sarah Hernandez. I know it's kind of costly and it's probably not covered by insurance, but she is offering that service to other autistic people so that you can get a robust report of your sensory needs. But yes. Okay. Question. My son, 8-year-old, does not try any new foods. He is on the same food for already 4 years. Is there any way to increase food-related flexibility? So I would seek out. Goodness, I forgot her name. There is a book, and I'm gonna Google search it because this is what I'm going to do while I'm presenting a parent. But there is a book that I do recommend. And it is Helping Your Child with Extreme Picky Eating, a step-by-step guide for overcoming selective eating, food aversion, and feeding disorders. And it is written by Katja Rao and Jenny McLaughlin. Everyone that I have recommended to has said that they love it. And it is not compliance-based. This is not a compliance-based book at all. It is meant to help with selective eating specifically. Yes, one more question is fine now. I feel like the philosophy paradigm, at least in early childhood special education, is that the goal for children with hypersensory experience is to help them overcome those sensory irregularities. That the right treatment, these children will eventually be able to feel the body in space, or to be so sensitive or not be so sensitive to certain sounds. Am I hearing correctly through these sessions that this is a totally and likely harmful myth? Or is there any benefit to therapies that aim to train people's sensory experience by being better? Yes, that is a complete myth. If you look at what neuroscience has done to on repetition of sounds and these sorts of things, it is still painful. So most of these things, most of these kinds of therapies that you're talking about are really looking to desensitize, and I suspect that they come from the same areas of like PTSD desensitization, which is meant to help you unlearn that a sensory stimuli is harmful. Well, you can't do that if the sensory stimuli is still harmful. If it still hurts, if it's still painful, all you're doing is telling somebody to stop reacting to that. And that's not helpful at all. And then you get children who then in adulthood don't have any skills to help with those sensory problems, and likely just are like, I've just got to tolerate this. Well, you don't have to tolerate anything. I have a session tomorrow with a different conference where we're actually going to be looking at like what it is that people do already for their own accommodations in these areas. Like if you have a sensitivity to wool, the answer isn't that you're going to wear wool every day over the winter. You're just going to find heavier clothes to wear, so you don't have to worry about the scratchiness of the wool. Well, why are we doing anything different with somebody else who has a diagnosis just because they have a diagnosis? I'm sure there's plenty of foods that you don't like the taste of. I can't stand pineapples. No, I love citrus fruits. Like I love a lot of citrus fruits, just not pineapple. I'm not going to expose myself to pineapple then. I'm not going to say that. And so we need to really need to stop thinking about sensory sensitivities as something that we can get rid of. We can't do that. It's not, I have never seen research to support that, ever. All right, I'm going to go, how much time do I have left? Sorry. Can I get an update in the chat on how much time I have left? Thank you. So next we have our highly restricted and fixated interests that are abnormal in intensity or focus. And oh, this is such a lovely thing. Okay, so when we're getting into to our interest areas, and you will probably notice I will not use the word special interest because our interests are not special. Our interests are our interests, and just our ability to focus on them. And so this gets into our shift of our executive functioning here. I'm just realizing that my lines didn't connect there. Oops. So if we get into our subject area, and it's really happy making, because everyone's interests are happy making, right? You wouldn't be interested in it if it didn't make you feel good. Well, your ability to focus on that. Again, this is the opposite of shifting shifting easily is going to be being able to focus strongly. There is a really, really awesome word that has been told here or been coined here for this, and it is monotropism. And so if you are a researcher or clinician or educator of any sort, look up monotropism. And it is that is our ability to focus on a single thing. So really some cool research also behind this in the way that we teach. And this is really important for teachers out there, that if you have they took 3 different settings. You had a video where there was no background information and just a person instructing. A second one where you had background information behind the speaker that was not related to the subject area. And then you had a third one where you had the information in the background was related to the subject area of what the person was teaching. And what that research found was that for everyone, they could tune into what the teacher was saying in a pretty predictable way. But autistic people not just learned and retained the information from what was being taught, but also all of the background information, both when it was in line with the subject matter and when it was not. So this is monotropism at its best. That we can tune into far more information and that we will retain far more information if we are immersed in a subject area. This suggests that we should have in classroom environments the visual information that is up on the screen or on your bulletin boards, and what you're saying should all be in line together with that one subject matter. This can have implications to the way that you set up your classroom, where maybe one wall is for your history and a different wall is for your science. And in that way, you're instructing from that side of the room so that you can have a lot of information available, and that just enhances learning because you have now aligned everything to be for an autistic person's cognition style. And you are not going to see you shouldn't see a reduction in the way that your neurotypical students learn. They still retain the same amount of information either way. So you can set it up. You can have this whole universal design thing going on that helps more students. But there's nothing uniquely bad about having a highly restricted or fixated interest. As I said when I went over this the first time, you would never say that to a PhD. Someone with a PhD is you're going to listen, or you're going to recognize that their restricted and fixated interest is what has allowed them to become an expert in their field, has allowed them to get that degree. We are denying that ability for autistic children when we try and take that focus off. I really like Paula Kluth and Patrick Schwartz's work on using autistic children's interest as a means to educate. So it's a really cute book, Pedro and his whale, and then the corresponding activity book, Just Give Them the Whale and You're Gonna Love This Kid, are there 2 books that I highly recommend so that you can start to recognize that you can teach way more if you are just going from a person's interest. And in a general ed environment, if you aren't wanting to do this for this one interest for this one student, then having it where everyone gets to have their own particular focus area, but still learning the same exact things, it can be really helpful. And it makes it really great because we know that academic achievement is usually pushed by the wayside for a lot of autistic students, with a much heavier emphasis on life skills. And I would that when we are doing nothing but teaching life skills, that all we're doing is teaching a student how to survive. And survival is not the goal of being a human. Autonomy is. And so if we can recognize that we want to give all the skills that we possibly can so that we can help them have autonomy, that there's a lot more out there in adulthood that has to do with helping somebody do their ADLs than there is for someone to have social outlets. There just is, because it's, let's be real, it's a lot easier to hire somebody to come in and clean somebody's home than expect somebody without a reading education. More important skills than what we can do teaching ADLs. All right. I think I am ready to go into questions. So let me go back up to this first question. My son's day program suggests moving my son away from the group during lunch because he started swiping food and shoving it in his mouth. I have made suggestions that would work, but private day programs also have the option to not do anything and just say they are not suited to help my son. Has happened twice already. So I am trying to approach this in a way that they can understand and offer easy intervention options. I am trying to explain that this is not just bad behavior, but in fact more of an impulse fixation on chocolate treats such as Swiss rolls and Oreos. It's not his intention to hurt someone's feelings, but is his intention to get the treat shoved in his mouth. Any advice to me on why he's doing this, even though he has similar treats of his own? Is this a stem, pop up, grab the item and shove it in his mouth? Or is it involuntary, or is he doing this on purpose? My son is nonverbal, expressive, and receptive. All right. I would say that, one, I can't tell if this is involuntary or on purpose. If he can't inhibit himself, he may still be upset with himself for not being able to do that. And so I want to have that. I want to make sure that we're giving that space for him to have his own thought patterns there, and so I can't make that judgment, period. I also wonder if part of this is that that he feels he won't be able to have those treats, and so have treats been withheld from him until he has compliant behavior. And so this gets into a lot of really big problems that we have with any way that we are treating these kinds of problems. And I think that the sheer act of quickly shoving it into his mouth suggests that he doesn't trust that he will be able to have that kind of treat. And so then it is about gaining that trust and building up that trust that he will get what he wants, at least eventually. Like there is always going to be reasons why you can't have it in the moment. Like if it's not available, like if there's not chocolate available, then this may look like the only chance that he's going to have for it. And so I really want, so I think a lot that's going to be happening that you're going to want to look at here is ways to support him knowing that he will have that treat. Yes, even if he has the treat, has one of his own, does he see that that treat exists? And then if the problem is impulse control, if he is upset that he is not able to have that treat, or that he is grabbing that treat, maybe we do set up the environment so that he doesn't have as quick of access to it of somebody else's, because that is still their thing. That is it becomes a conflicting access need of they should still be able to have the treat out, while he also should be able to not have access to it if he's doing it unintentionally. And so it's really going to come down to finding out whether or not he is upset that he's doing this, or if he's doing it purposefully because he doesn't trust that he will get his treat. All right, question. Should I create a get to know me or how I like to learn type of introduction page for my autistic child's classes, teacher, and coaches using appropriate language and terminology throughout? I think that this is a really useful thing to do, yes. I think that it is important to be able to do, or for people to understand these things. I also think that, or I should also just say, I'm going to just say it up front, there are some teachers that are not going to welcome that because they already think they know better. And so that has a lot more, that has a specific issue, right, that we need to be addressing, which is how people are trained, which I hope that this training, this conference helps a lot with that, even if it's a small step. But I think having that sort of thing, and then not only get to know me and how I like to learn, but also what is useful for these things. All right, next question. How does the working memory work? How does visual work? All right, so let's go with visual first, and then I will go into the working memory. So visual information is going to be processed by taking the information in, obviously, through your eyes. And then that information is going to be processed in a part of your brain. And I forget the part of the brain, but when it goes into that part of your brain, for some people, what happens is that we subtract, or that they subtract information that is irrelevant to them. So people looking at me right now, what information are they going to get? Well, a lot of people are going to be centrally focused on me. But if you have hypersensitive visual information, then you are probably getting all of this stuff back here behind me. So you're seeing all my STEM toys, and you're seeing all my books, and you're seeing the block towel. So when we get that information in, what do we, it is a matter of whether or not our brain decides to erase it. And since I have just said all of it, nobody currently has that information erased, because you have just had it pointed out to you that there are STEM toys here, that there are books here, and there's a tower of blocks here. I am assuming, of course, that you have, that you are sighted. If you are blind, then maybe you aren't saying any of that information. Now, the way that works with our, it gets so complex. Okay, so visual, if we are able to then focus our or on a particular visual input, so say me in particular, you may still not have the ability to do the planning and work in that sort of stuff to be able to stay focused on me. So this can get into issues with eye tracking software and that sort of thing if we are not able to do the motor planning piece of keeping our eyes tuned into what we're looking at. All right, so when we're taking in this visual information, it then helps us to recall other information. This is our working memory. Working memory is our recall in the moment, given what we already know. So an accommodation that we see a lot in IEPs that helps with working memory is to preview text before getting the assignment. This can also look like having notes for tests, because if we can't recall, or if we can't easily recall the information, then having something visual there that will help us recall it, or even auditorily. Any way that we can get information in will then help to reignite the memory that we already have. So this can look like, oh, don't you remember I talked to you about this? No, I don't. But if you can then go through and like describe the conversation and describe the setting, then the person may be able to recall the information. And so that gets in, that affects, that is then our working memory. And this then gets into I'm using that script a lot. This helps us then recognize that every bit of sensory information that we get is affecting our working memory at the moment. This is also why I believe that working memory gets worse when we're stressed, is because we don't have the faculties to be able to, and this is generally for everyone, we don't have the faculties when our brain is overloaded to be able to access the information that we need to remember things. So this is why it's important to have calendars, and this is why it's important to have to-do lists and all of these sorts of things. So that we are not actively having to remember everything. And since we have, and while that means that if we are focused on a certain subject area, we may be able to recall those things more quickly because it's an interest area, that does not mean that we are going to be able to have the same working memory for like everything. It all is basis in what is important to us and what we're able to do according to how much stress we have. I should have went over to my question slide. I'm going to leave this here. If anybody has any more questions. Oh, there we go. Question. My 6-year-old has difficulties with social communication. Her healthcare providers have recommended that I pursue social skills groups or curricular like We Thinkers that I believe may be considered ABA. Doctors that I otherwise trust and who I believe to mean well have suggested that there are some ABA techniques that are not harmful, but I am skeptical. How much therapy should I pursue to help my child learn to function better in an NT world versus how much should I let my kid be who she is and focus on making the world more accepting? Related question, what are some harmful goals that you often see therapists work on with children? All right, so the first question, I am pro-therapy. I'm just anti-ABA and compliance training. So all ABA tech, I'm going to refine that before I get to that whole sentence. There are a lot of techniques that are used in ABA that are not ABA techniques. I'm going to start there. Just because you can describe something with ABA terminology does not mean that thing is ABA. ABA is literally about using a complex system of rewards and punishments in order to change behavior from a socially unacceptable behavior into a socially acceptable behavior. That is all ABA is that process. That process includes grooming a child. They typically use the word pairing when they're talking about the grooming stage. But this is, there's literally a phrase in ABA circles called the giver of all good things. And this is where we get into the ways that we are grooming a child in order to, that you are supposed to become the person that gives a child everything that they want. And so this initial premise is, if you do what I want, you get what you want. And we will start the cycle over again. This is how we end up training an autistic child, right? And if the child is incapable of doing that, then they end up being punished. And I'm using punished in a in the lay sense and not in the ABA sense, since I know that that they have a completely different definition for punishment. So I want to make that upfront so that if you are tuning me out because I use punishment wrong, that says a lot more to do with you than it does me, because any lay person is going to hear punishment and know exactly what I mean. So you end up being punished by not being able to get the reward that you want, through no fault of your own other than you can't do it. Next, when we get into what therapy we should be doing therapy to figure out what a person's sensory support should look like. So we should be doing OT so we can get occupation, or so we can understand what a person's sensory profile is, to then work within that to find what works best for the person to get those sensory needs met. And having this is incredibly important because, and it's ever growing and ever changing, because as a person gets older, the ways that they need to interact with their body is going to be different, just because our bodies grow and change. Instead of doing social skills groups, I highly recommend doing speech therapy with somebody who understands the need to get shared understanding in a social interaction. So this is going to look like, what scripts can we do if we don't understand the rules of a game? How do we express the fact that the reason that we are flapping is because we're excited? This is especially, and I think it's something that we really need to work on, is a social curriculum that is equally expecting work on both sides of that equation. So the way that you express excitement is different than the way I express excitement. And that both ways are valid. I have a hard time with emotional reciprocity because I can't read your emotions. So I may instead ask you how you are feeling. And then I want an honest answer, which I know is hard for people to give. But this is the ways that we can help a autistic child learn how to engage socially. We can also do it through our interest groups. So like if your child is, I'm going to use some very stereotyped examples here. So I apologize. Know that you can have interest out of these areas, but like if you have a child that is really into trains, well, there are usually train groups in your area. You can, and some train, or especially in metropolitan areas, but metropolitan train areas may have groups specific for kids. You may be able to create a Lego group. I don't know about your areas, but in my area, there are some smaller Lego stores that you can set up to go have regular build days. Um, and so you can do these sorts of things so that you can have that social engagement with a subject area that your child is already interested in and their peers are already interested in, and be able to learn how to engage because you are already bringing something to the table that everyone has agreed to or agreed with. And this allows you to experiment with your social a lot more because you are not being rejected because you don't have anything to give. In the social environment because of not understanding the rules. You already know what the rules are if you are already interested in the thing. All right. One more question, and I think I might have room for one more after that. My friend couldn't be here, but she has a son who is dealing with RFID. She is looking for tips to help her child through this. I am again going to recommend the book, Helping Your Child with Extreme Picky Eating, a step-by-step guide for overcoming selective eating by Katja Rowell and Jenny McLaughlin. It's a really good book, and it will really help with strategies that are not coercive to help a child that is having a hard time with restrictive eating, especially even from sensory for sensory reasons. This will be the last question, I think. You touched on executive functioning. From what I understand, as a deficit in a non-judgmental way. Do you have resources to share that can help autistics improve this area? Thinking specifically about shifting, planning, and organization needs. No, I don't. Because all of these are things that we need to have accommodated. So, so with shifting, having a lot of strategies around making sure there's pre-planning and post-shift spaces of time. With planning, having somebody that can help you plan. I know that it seems like this should be something that people should be able to learn, but if you look at a list of demands and a list of things and you know you have to get all those things done, then making a plan for that then requires you to prioritize what's already important. And so what I do for myself, and literally what I did for this, I hired somebody to make my slides. I hired somebody else to make my plan for getting a project done that is going to need to be done within the next month, because I can't do it for myself. Now, I recognize that I have the privilege of that, but you can also get that help from your peers, from your friends, from your teachers, all of these things. Once you're on a college level, you may be able to go into a writing, your writing workshops on campus to be able to have them help you with the planning stage and the organization stage. In a job, you can ask for your boss to create your priorities, or you can work with a colleague to make those planning priorities. With the organization, I have not seen anything that suggests that we have poor organization skills. We have a lot of sensory things that can make organization overwhelming if we have too much visual information. But I've not seen anything that says that, and to be clear, organization, when we're doing executive functioning, is specifically talking about the tools that you need to organize, or the tools that you need, and having those organized. Anything else is in that planning piece. But we need to shift from trying to teach a brain to do a thing it doesn't do to accommodating that thing so that we can just know what those accommodations are. Because usually what happens is we end up having a lot of prompts to get these things done. And then we can't do it on our own because we no longer have the prompts. So coming up with, if you can come up with like flow charts that can help a person, and then they can follow those flow charts, having examples of these kinds of things. But I would never ever expect somebody to be able to do those things. I would very much expect the accommodations, and many of the accommodations for those specific executive function things are things that are considered reasonable in a job and in school and in college. All right, my time is up. Thank you so very much for being here and for all of your questions.